Okay, I'm going to get this started. I have a little just after 2 o'clock in the afternoon. I want to welcome everyone to today's event. We're calling this 3D printing for the health field and libraries. And this is in response to some really great discussion that's been happening in the Rails email list, including the Makerspace email list and other places. Before we jump into this, I just want to start by thanking some people who've been involved in putting together today. The first is Jen Hovanek from Indian Trails Public Library, who was instrumental in helping get this started. Thank you, Jen. I also want to thank Dr. Bonnie Chen, our guest today from Amita Health, who's very graciously agreed to give us some of her time. And then thank you also to Jim Olgan, who's joining us as well, is going to help answer some questions, and Karen Keefe and Ridgway Burns from the Hinsdale Public Library, who also had a really big part in setting this all up. Thank you all for being here. Okay, so what are we doing? It's going to operate a little bit differently. It's going to be maybe a part webinar and then part discussion. So we're going to start with just a presentation from Dr. Chen, and then we're going to jump directly into questions. I want to thank everyone who submitted those questions online. Really appreciate that. We had a bunch of questions come in overnight, which is fantastic, and we'll try to get to as many of those as possible. And I do want to note that when we move into the Q&A portion, that's when Jim and Ridgway are going to jump in and kind of help answer some questions. There were a lot of great ones, and we'll try to do as much as we can to get to all of them. So once we're finished with that portion, we're going to move over to the networking group discussion, and that is going to be led by Jen and the Makerspace networking group, and that's going to primarily be taking place in the chat box. Just in case you were wondering, there is going to be no video. I'm sorry, you're not going to see our faces today. It'll just be audio and the slides that you're looking at right now. Again, I do want to note that this is being recorded and we will put it up on the Rails YouTube page when we're done today. So we're going to look to wrap up right around 3 o'clock. I'm sorry if you were hoping to do more and if we don't get to all the questions, but we're going to try to do this as quickly and as efficiently as possible today. Okay, so let's, before we actually jump in, just a couple things. You can participate via the chat box, and if you look on your toolbar, which should be at the top of your screen, you're gonna see a chat icon, so click that, and then if you're chatting with other people, make sure that you're using the all attendees and panelists option so that everyone gets a chance to see it. And that is gonna be important for when we move into the discussion portion of the afternoon. Okay, so I have finished talking and I'm going to turn it over to Dr. Chen. Dr. Chen, thank you so much for being here. We really appreciate your time.
Great, thank you so much. And thank you for everybody for getting on the phone today about this 3D printing effort that we're putting together. I mean, as you all know, this COVID pandemic is unprecedented and something that has taxed our healthcare system far more than it has been taxed as far as I remember, and I've been practicing for a number of years now. And part of the challenge that we have at our hospitals is PPE, which is personal protective equipment. And as you know, COVID-19 is spread mainly by close exposure with a person-to-person transmission via respiratory droplets. So if they're coughing, sneezing, talking, and so it could land in the healthcare workers' mouth, eyes, nose, and when they're doing procedures or transporting or intubating, any of those things, then that is a potential spread to that healthcare worker. And we also have a limited number, not just of PPE, but of healthcare workers and people who can help take care of all our patients in our communities. And so that's another kind of a valuable resource that we need to make sure that we protect. So right now, what they're doing is there's disposable face shields that the healthcare workers have, and they're hard to come by because everybody needs them. And so the burn rate for these is quite high, and they're actually reusing the reusable face shields right now, trying to clean them in between and trying to make them last as long as they can because there's only a certain amount that they can have. And so what we were looking to do is try to find a way to provide them with something that is reusable. And that's what the 3D printing has been able to do. We found a good model from the Prusa company, which is based in the Czech Republic. And it's been tested over there very well. I have actually colleagues over in the Czech Republic that I've been communicating with and telling me about their experiences and how they're using and building as well. and they've been using this primarily as well for their face masks. So what we're looking to do is try to see if we can rally up people who do have 3D printers, so libraries, school systems, anybody that might have access to that, to be able to help produce some of these parts for the face shields. And then that way we can provide our healthcare workers around this region with face shields that they can use and reuse and then just clean after their use so that they have something and they know that they're not going to run out. So that's sort of my intro. I don't know if anybody has any questions.
Yeah, feel free. Everyone should feel free to put some questions in the chat box. In the meantime, we might as well just jump in to the Q&A portion here. So Dr. Chen, I think I have a question right off the bat for you. This is a question that came in via the form. If you are sick or might be sick, should the common person be should the common person be contributing 3D printed PPE and other PPE, or would a hospital be able to sterilize such pieces before their use?
Right. So what we're planning to do, and I think if you're sick and very visibly sick, and I would say I would probably avoid handling any of this equipment, obviously, because they're going to be having it near their face. Even if you're not sick, it's recommended that when you are handling this equipment to treat it like you are. So if you can wear gloves, a mask, and handle it like you could potentially contaminate, that's the best. What we are planning to do is have the healthcare workers decontaminate it before they use it. So they will be decontaminating before this first use as well. So that part will also be done on top of all the precautions that you guys will be taking.
Great, thank you. So another person writes in, I'm concerned about using PLA to print face shields. Has any medical organization studied how PLA holds up versus other more robust filaments?
So we've been talking about this part as well. I think PLA is one option, and it seems to hold up well, and we can clean it with either soap and water or the sterilized wipes that they are hospital approved. Now, we also have to keep in mind that those wipes are low too. There's low numbers of those, so they're actually probably going to be going through a lot of soap and water to clean these. We're not looking to sterilize these in a very hot, like autoclave or steam sterilizer. But there is a PETG, I think, and Ridgway can probably speak more to this, that he's ordered that is more heat resistant, less brittle, and more flexible. So that is probably the preferred filament, if possible, but I'll let Ridgway chip in because I think he knows this part better.
Prusa recommended the PETG as a better filament for printing the mask. I haven't gotten filament in, so I haven't tested it, but they said it's preferred as being more durable and more comfortable to wear.
All right, thank you both. Appreciate that. Another question, maybe more towards just Amita and your organization. How are the pieces made regularly? Are they always 3D printed, or is another material generally used?
Right. I don't know how they're actually made. They're made to be disposable. So the materials themselves are not as good as what we're creating right now. And I know some of them, they have like the foam, and that's not really easily cleanable either. So that those aren't really preferred over what we are creating with the 3D printers.
And how many hospitals are in the Amita network in general? Will any donated pieces be sent there?
And we have 19, and they're spanning everywhere from Chicago to Kankakee to Aurora. So they're all over. We're probably the largest the hospital system in this Chicagoland region. So we do have a system with many, many hospitals that have this need.
What would be optimal for Amita Health? How many shields? How to submit them? Is it a good idea to submit them as a unified supply from all libraries?
Yeah, so I think it's going to probably depend on who's going to be able to help us out. Depending on where you're located, we might be able to try to direct those towards the hospitals that are nearest your area. I have team members of my team that could go and help with that pickup and delivery and assembly of these masks, because the shield portion, I need to be able to estimate how many we think we can make, and then I have to buy the shield material as well. So that's the other thing I'd like to find out from who's actually interested in making these with us. And then I need to go purchase the shield and the headband materials to attach to the 3D section.
Great. Okay. Thank you. All right. At this point, I'm going to ask Jim and Ridgway to come in and answer some questions. So we have a question about costs and availability of raw supplies. Do either of you can either of you sort of answer that question?
Sure.
So, Ridgway here.
Go ahead, Ridgway.
Thanks, Jim. So we're able to print and bottom reinforcement portions per 750 gram roll of filament. And that works out for us with our line ordering directly from Dremel. It's about $1 a mass to print those pieces, plus a little actual face shield portion. So about 32 mass per roll of filament. So your cost will vary.
Okay. Thank you. Jim.
A little bit more.
Sorry about that. Anything else to add?
Yeah, the other part which we've been taking care of thus far is the clear plastic face shield portion of it. The cost of that really varies depending on the material, and we've been testing probably 4 or 5 different materials just to see which ones work better from a availability standpoint, because there is this huge need across the country. Access to that material is difficult to secure, but that's something that we've been working through and finding some suppliers, and from a cost standpoint, like I said, it really varies a good amount, but thus far, that's not, that's been something that, we've been taking on behalf of, the hospital. So from a library perspective, what we've been asking them, the Hinsdale Public Library is just the 3D printing portion of it.
How much time does it take to make a shield?
It's been taking us 3 hours to print a single headband. There are some, but in terms of sticking to the recommended settings from Prusa, it's taken us 3 hours to print one.
3 hours per one. Okay, and then what does that mean for you in terms of staff commitment and the time in your library that it takes?
At the library, we're asking staff to come in at 8 a.m. and at 8 p.m. because we're running them in stacks of 4. So a staffer will come in, clear the printer, and then start another print. So every 12 hours, we'll have 4 popping off.
Okay, this is a specific question about equipment. This is we have a Dremel 3D45 printer. It looks like the Prusa design and other approved headbands do not fit on this printer. Are there other designs or other products we could be printing to assist?
So
we have
I was
the
wondering.
Same printer at Hinsdale Public Library. This is Ridgway again, and it does fit. It just goes over the guidelines, but you can print it and it works as is. You just got to do the single stack of 4 versus the one that's spread out.
Bonnie, did you want to jump back in?
Oh no, I was going to say if there actually is a printer that doesn't, and then thank you, Ridgway, for that. I was going to say there's the smaller piece that is for the bottom part that maybe the printers that wouldn't be able to fit a larger. I don't know. I don't know the printing details, but Ridgway, is that an option?
Yeah, they could print the bottom reinforcement part, the part that clips onto the bottom of the clear plastic part. That's an option too, and those are smaller.
And I think we were also, there's multiple ones on the Prusa site, and we're looking at doing the American version. Ridgway, you could probably send out the actual one to everybody, right?
I think I dropped the link into the chat, and it's also available on the Hinsdale Library website, which points you at the current file too.
Thank you.
It's got a 3-hole punch, which makes it easier to do the pieces that for the face mask that hooks into the front.
Great, thank you for that. couple questions that have come in via both chat box and the Q&A section. Someone asks, are these masks worn over N95 masks? And then also, how are these masks sterilized?
Yes, and they are worn over N95s or other masks, and that helps protect them. Some of the N95 masks actually are not as waterproof as they should be, which is one of the reasons that this is so needed. And they will be cleaned with the hospital grade sanitizers, or like I said, those are kind of running low too, so soap and water also works. I was working with our infection control preventionist this morning with our prototypes that we created, and she absolutely loves them and is extremely excited about these.
Excellent, thank you. Okay, couple other questions. So one of the questions comes in from the chat box, just would we be able to coordinate efforts and due dates with Amita?
Sure, absolutely. I would be happy to try to coordinate. So if they want to send an email to me, that would be great. Then that way we know who is participating, how many you will be expected to do, where you'll be located, and then that way I can order face shields accordingly, or if you have face shields too, or however we want to set this all up, that'd be wonderful.
Excellent, thank you. Okay, I'm seeing a lot of questions, but some of them are being answered in the chat, which is awesome. Thank you everyone for jumping in. Let me just ask this question to all three of you. Is there anything else you want to, are there any questions here that haven't been covered that you want to talk about, or any other aspects of this that, that you want to share?
Yeah, I think the only thing we want to say is, we would, to the extent that there can be help, we'd appreciate it. Our goal would be to make it as easy as possible, for you guys to be able to assist, and that's why, in terms of picking them up and figuring out an assembly, we're willing to to take that those parts on. Because once again, that we want to make it as easy as possible for you all to help, and the kind of the critical component is just the access to the equipment and the ability to to get the print started and taken care of. So whatever we can do to facilitate, we'd be happy to do that.
But Bonnie or Ridgway, do you want to jump in and say anything else?
I'll jump in and say.
Go ahead, Ridgway. No, I was just going to thank everybody once again just for getting on and your interest and your willingness to help. It's so important because this is such a vital piece of personal protective equipment for our caregivers who are taking care of everybody, that is this extremely appreciated, extremely necessary, and thank you so much for taking time to be on this call and to help us out with this.
Thank you. Ridgway?
I just want to say, if you have any questions specifically about getting to print with your, I've worked with MakerBots and with printers, so feel free to reach out. My email information are available on the Hinsdale Public Library's website. I'll also throw in there that it's worth reaching out to your school district and seeing if they have any 3D printers that they might be able to contribute. I know we're working with our District 181 MRC directors to have them be printing the pieces. So rather than just our printer, it's 6 printers spread across Hinsdale.
Awesome. Okay.
And we're number-wise, we're looking actually we're probably going through at Amita close to 3,000 face masks a day, and that's with reusing them. So if we're able to get somewhere in that range, and not even that close, but if we're able to get somewhere in that range, that means that everybody could have one of their own and they wouldn't have to worry about running out.
Awesome. Excellent. Okay. Thank you. Okay. I think this will conclude that as the presentation portion of this. And I want to thank again all of our guests for joining us. Bonnie, Jim, especially, thank you for coming. Ridgeway, thank you so much for answering the questions. At this point, I'm going to turn it over to Jen, who's going to lead us in the discussion portion. Jen, are you ready?
I am. Could I possibly make a suggestion before we lose Dr.
Sure.
Chen? And so one of the things that is maybe a little bit different at some of our neighboring libraries is that we are currently not allowed to be in our buildings. So we may have access to the printers and things like that, but for me to go to my director, it would be great if maybe Rails could coordinate and put out a date at a pickup site, even if it's just like one specific one. That might give me a little bit more credence to be able to say, I know we're not supposed to be in our building, etc., but this is a date, and if I can contribute something by this time, that might actually get a more coordinated effort. So not that that has to be decided today, but just to keep in mind that you probably have a lot of libraries that would love to participate, but without that due date and that sort of looming opportunity to say, hey, this is a deliverable. You know, some of us may have a little bit more challenging of the time being able to coordinate. So if there was some way, whether, you know, instead of all of us trying to email you, Dr. Chen, maybe there's a way that we can say, hey, pick this date and let's start here. And then we could set more dates up from there. That would just be a logistics suggestion that I had for sure.
Yeah, we could definitely do that. And I think, you know, we'd be happy to, whatever discussion comes out of this, the discussion portion would be a great sort of way to figure that out, what is possible for our member libraries, and then, you know, figure out what we can, in terms of how the process for submitting those things would be great.
Awesome.
Yeah, sounds great.
Okay.
So we'll look for that from you all then. And then obviously I'll make sure that that gets out to our other networking channels that we have as well around the state of Illinois.
Great.
All right, awesome. Well, the second portion of the meeting today was really a branch to start talking about some of our plans for the future, but also some of the things that you're doing right now. And while this is a little bit different than we generally get together with Makerspace Networking Group, this is definitely an opportunity for you to, you know, reach out and talk to some of those people that you would normally talk to. So I am happy to facilitate in the in the chat box if you have questions, and we can start from there. So one of the questions that's in the box here is from Jessica Frazier. Hey, Jessica, what's up? It says that for libraries who are 3D printing, did staff bring the 3D printers home, or are you using it at your library or your building? So if we can get a little feedback on that part, that would be lovely. Wow, you guys have a lot of nice directors letting you take all those expensive tools home. That's great. And kind of a take off from that as well. So for Hinsdale, are you, so people are in the building while it's 3D printing, or are you letting it run while no one is in the building? Yeah, because our insurance plan does not allow us to use a 3D printer while it's not in the building. Well, we're not in the building, excuse me. Awesome. And well, ours is the burning down the building portion. are when we're looking at, for those who are printing at the library, how many people are using the printer? And I guess kind of how are you scheduling those people to print? Would it be helpful if I read these as well? I know.
Yeah, Jen, that actually might be, and I'd be happy to kind of help you out
Sure.
with that. Yeah.
Yeah,
One thing I will note is the chat will not show up on the video version of it. We can produce a transcript of this, but it might be more helpful if that is kind of talked about or read off while people come in.
perfect. Well, let me scroll back a little bit then. So it looks like quite a few people were able to take their machines home, which is excellent. There are a few people working out, and Stovall said they're using it at the library. Hinsdale and Ridgway mentioned that they are using it at the library as well. Lots of people taking it home still. Sarah has a question regarding, so for those of you who are printing it at home, how many people are using the printer, and then the concern is really about contamination, which is a good question. Oh, Ridgway shared an awesome 3D printer schedule link, so that's great.
Chris is asking if someone can post the link to the stack of 4 US Prusa mask file. If someone would post that again, that'd be helpful.
Hey, Ridgway, is the 4-stack have the US version as well?
I'm sorry, you dropped out for just a second. What's the question?
Does the 4-stack is there a US version of the 4-stack?
Yeah, into the chat.
Okay.
So it looks like, Chris, you can scroll back up there and grab it. I think Ridgway just put one in as well, but it looks like that one just went to the panelists. So let's try and reshare that again. Yeah,
Okay. Yep.
So Anne says that they have one person who is testing various shields, and now that they have the recommended design, they're going to create a schedule and try to have more staff involved, which is awesome.
Patrick also asked for the size incompatibility issue with Dremel build platforms, if anyone's tried to rescale the model when converting the .stl file to G3 Drem file, and he says he doesn't have a printer in front of him, but that might work.
As far as I know, you don't have to resize it. I haven't had to resize it to print on our Dremel. It is right at the edges of the build platform, but we've turned off resizing for it, so it should be the original file size. And that's the one that Amita tested. So I think that works for them.
Okay, thank you, Jim.
I think that's really great to hear too, knowing that this is a model that actually is tested and is working. There are just so many different things flying around, and all of our well-meaning patrons and members are sharing things from all over the net. So it's great to hear something that works. Patrick is double checking, is it a Dremel 3D40 that you're speaking of, Ridgway?
It's a 3D45.
Yeah. Okay. And then Justin Franklin is making the suggestion that he got it to work by turning off build plate adhesion. So that's that extra lip that's sometimes helpful. Juan Reyes asked the question, how are you handling quality control / inspection of the final print? And Juan, is that for the library or when it gets to the Amita healthcare system? Or maybe both.
Yeah, actually what we've been, this is Jim, we've been handling the quality control part because when they come off the printer, they're still some of the little fibers and things like that. So we're taking care of getting all that stuff removed before they're assembled and then provided to the hospital. So right now we're taking care of the quality control regarding that.
Oh, that's great. Donna McCartney put out the question. It looks like this specific model requires elastic. For the Amita Health System speakers, would that be something that libraries should also be trying to source, or is that something that you have available?
We have some available, and it's been kind of interesting as we've been putting this together and looking for materials, what has been running out. But because face shields have, and just masks in general, are something that is in need. Elastic has, at various locations, they've run out. So we've been able to procure some, and so we've been adding just kind of elastic, that you might find at a fabric store. Kind of the ideal one is what they call buttonhole elastic, which is a elastic that has multiple little slots so that a user could adjust how tight it would be around their head. But that has been difficult to source just because of the demand that's out there right now. So in terms of, what, if anything, the library could do, and we haven't used rubber bands at this point in time, but, to the extent if there are, if you see that you might have access to, a little bit larger elastic, that, that might be a possibility. You could, you can send, just a photograph or a description of what you have either to Bonnie or I, and, we can give you guidance on whether, we think that it would work.
The one of the methodologies that Sarah was using as well when bagging and preparing the items, she says she, in addition to wearing gloves and a cloth mask when handling face shields, she's also been wiping them, bagging them up, and setting them aside for 3 days before moving them any further. And that's as a precaution, since the virus generally can't survive for 72 hours on most surfaces. So another library worker, Anna Gillespie, said, I've been making cloth face masks and pulled some, I'm guessing some elastic from fitted sheets, but the elastic is hard to get a hold of. Jeffrey Fisher also mentions 2mm hair ties work for elastic. Carrie Burnett says she was able to order a 3/4 inch button elastic from a site called Strap Crafts, which is great. Alyssa shared that Mood Fabrics in New York appears like they're still shipping, but they have elastic still for sale, but there might be a delay, which makes a lot of sense as well.
And I want to encourage people, if they have links to a lot of these places, that would be, yeah, thank you. That'd be a lot of help. That'd be really helpful. Just especially if you have a supplier that is working and you like and seems to be in stock, that's always really helpful.
For the Amita Healthcare panelists, one of the other questions that was above had to do, there is a National Institute of Health approved mask extender that can be 3D printed. Those are fairly small and can be done on a fairly smaller format machine. Is there any interest in something along those lines? I think it may be geared more towards the cloth face masks, but I don't know if that would be of any interest as well.
Yeah, we'd have to take a look at it and let you know if that's something that would be helpful. But if the size of the 3D printer that you have can't do the top portion of the face mask, if you look at the files, there's also a small support piece that gets attached at the bottom of the face mask, and those would be able to fit most 3D printers. But yeah, I'd be happy to take a look at that other file as well.
Just put it in the chat box if you were interested in that or if that worked for you. It's a surgical mask tension released band. Let's see what else I have here. We have a question here from Chris. It says, at the request of an elder care facility, he printed 30 mask extenders on Monday. So there is some interest out there, maybe not necessarily for Amita's immediate needs, but there are some out there for other people, which is good to know. Monica Harris also recommends ordering elastic from individual sellers on Etsy. That's a good point. There are a lot of craft suppliers on there as well. Here's a question from Justin Franklin. It says, can a larger flat elastic band be cut lengthwise to make smaller pieces, or is that impossible due to its structure? For all you sewists out there, because that is not me.
Jen, one thing I might ask is any library interested in being like a dropping off point or a place that wants to collect these and is able to even because I think that might save us some time, and that might kind of answer your logistics questions a little bit.
Right, for sure. So if anybody wants to volunteer, you jump on in that chat box, number one. We've had a couple of other questions come in as well. So regarding cutting the elastic, it compromises the integrity of the elastic over time. So I guess that goes back to Bonnie and Jim as far as how long we're looking for these things to last, number one. Obviously, we want some durability. And then Alyssa Martin shared a link directly to Mood Fabrics elastic that is in stock. So if you were looking to purchase some, that could be a great place to start there as well. Ashley Middleton volunteered. She said New Lenox does have essential employees checking in the building multiple times a week in the morning on a specific schedule. They could be a drop-off site. They're very close to Silver Cross Hospital in New Lenox. Karen Keefe said Hinsdale would be able to take some of the donations. There's email addresses there for herself and Ridgeway to be able to set up a time when someone is in the library to do receiving. So those are actually two spots that are kind of great distances from each other as well. If there's anybody up north that's going to be available, that would be amazing. So we got our south, we got our west a little bit.
Yeah, and also just a consideration, how many masks do you think that we can even print in
Mm-hmm.
and how often would the collection be done, that sort of thing. So I'd be hearing Ridgeway speak saying that it takes 3 hours to do one. I think it would make sense to do it every week, but maybe that's not enough. I don't know. But I would be interested in hearing from other people what they think.
So while we're waiting for that question to come through, let's take a quick second and address. So Jeffrey Fisher asked the question, do the hospitals have an intake procedure? So when items, Jeff, are you asking specifically for like contacts to drop them off at, or what actually happens when they get dropped off? Just for clarification. Oh yes, where to bring them. So, Ashley, have you brought any to Silver Cross yet? I know you mentioned that you were very close. Somebody is mentioning the book drops as places is a good way to make a no contact drop off of the mask or materials. Some people are mentioning that their book drops are sealed and closed. Amy, I think for your clarification question, it sounds as though, and my interpretation is that yes, people could print the components for face shields and give the pieces to a central drop-off point or group, and then they are assembled. I think they would probably take both. Amita, do you need them to be totally put together, or can you use those 3D printed parts?
Yeah, the 3D printed parts are for us are right now is kind of the essential component. Obviously, sourcing the materials for the clear plastic portion of the face shield is important as well. But in terms of what our ask would be, to the members. Here, it would just is primarily just the 3D printed parts. We can take care of because we understand, from, just from a staffing perspective, having somebody be able to get the material, put it together might be a little bit more difficult under the circumstances. So we're happy to, to take that portion of the project on if, as long as, you get the pieces over to us and we figure out, or we figure out a way to pick them up from your location. We can take care of the remainder of the assembly.
Does that answer your question, Amy? If not, we can totally ask more for you. Ashley Middleton mentioned that she's been coordinating with Space Lab in Lockport, and they have a connection to DePaul University that's been organizing with Space Lab Joliet area maker spaces. So they're already putting some production out there as well. Sarah, I know, has shared on the makerspace list as well that Edward Elmhurst Hospital is accepting donations at their loading docks Monday through Friday, 9 a.m. to 3 p.m. So that's a great piece of information. It gives you exact place and exact time, which is lovely. And yeah, I think a lot of our book drops are sealed at this point. I know that we, at least at Indian Trails, obviously, since we're not in the building and we're not able to do that, we've begun to do the printing ourselves at this time. We began to compile a list of places that are also accepting masks and shields as well. So Northwestern Community Hospital in Arlington Heights is accepting some donations. So is University of Chicago Medicine as well. So that might be something to consider if you are unable to get to the Hinsdale location or the New Lenox location. There's, I think at first we were hearing don't send things, but I think as time has gone on, we're actually hearing from more locations that they would be open to those donations as well. So hopefully we'll be able to get a couple of hubs together in different regions for our makers. But if it's too far for you or you're from a different area of the state, try and make some connections that way too.
Yeah, and we can help with that too. For the most part, we do have folks at the hospital that live in different parts of the area, and they could assist in facilitating picking up the parts. And if it's a library that's downstate or further away, we can also try to identify some folks for you to contact that are nearby that you might be able to assist. So we can help with that as well.
And Dan did put in the check box. So if you think, or I keep saying check box, I'm sorry, chat box. If you think that you can be a drop-off point for other libraries and you want to learn more, you can email him directly at his railslibraries.info email address.
Yeah, and Jen, maybe we can put together some sort of spreadsheet of locations that are accepting materials, and we'll start with Amita and find other places, because I think, that's Abby. Thanks for that question. I was just thinking the same thing. Is Rails is a pretty big place, and there's people from all over that are going to be wanting to know that information. So we'll try to gather that, and we'll also try to get for those of you that can't get to a location or whatever, we'll try to figure out some sort of drop-off point for you. The best we can, sometimes the best we can sort of do is to create some sort of relay. Unfortunately, our delivery vans aren't running right now, and I wish we could offer that to you, but we're closed down. But it's good that we'll be able to at least maybe be a little bit of a clearinghouse for a lot of this stuff. So even if you have some ideas of where you can send stuff, send that to me. We'll put together something to sort of organize this in a little bit clearer manner.
I also like the idea that Christina mentioned there, possibly to include the locations and what type they're accepting, or also what they need, because I think that that's the other question as well. We've heard about a couple of different options now, so that's another way we can sort of aggregate the information. We've got so many, and maybe Dan, if we do this as like a Google sheet or something along those lines, maybe we could also toss in all the files that have been shared in the chat box as well.
Oh, that's a great idea, Jen. I appreciate that. Yeah.
Because there's been, we all also have different formats of printer files and all that jazz. So if we can put those into a reliable library sourced spot, better than the World Wide Web, right?
Having never 3D printed anything in my life, I'm I'm sure that is I'm seeing that there's quite a range out there of things you can files you can use. Yeah, Monica said we could also put that file on the Rails Pulse page. That's
Cool.
Absolutely, and everybody should check that out, because there's some great ideas on that pages too.
Yeah. We did have a question coming into the chat box, so I'm going to read this one out for you. So it says, one of the common challenges is the size of the print bed and the print. So would it be beneficial to have libraries print the bottom support piece only, or is that counterproductive to the extra time it would take to coordinate different locations and assembly pieces? So for the Amita panelists, are you going to be faced with an abundance of the bottom piece versus the head piece, etc.? Are you worried about that?
Yeah, I guess if you have the capability of doing the top portion or the main portion, that would be preferable. If the equipment that you have is only able to do this the smaller piece, then that would be a good fallback. But we can the face masks work without the bottom piece, but it doesn't go the other way around. So having the main top portion is preferable.
Juan, I think that might have just answered the question you submitted as well. Sarah had a good idea about making sure that when we're putting in the different files, including the print settings, that's one of the great things I found with the National Institute of Health files as well, is that they're giving you those settings right away. So we know that your mileage may vary with those as well. Well, it looks like, I think, Dan, correct me if I'm wrong, but it looks like we may have gotten all of the questions that were...
I think you're right. Yeah.
Along there. Does anybody have any last minute sort of 3D printing stuff for the good of the group? You got a hive mind of 52 people here right now, so now is a great time to try it out.
Well, while people are thinking and typing, I do want to say this has been a lot of fun, and I've certainly learned a lot. And I think, and I'm really glad to see a lot of people coming forward and doing this. This is really, again, the strength of libraries, is being willing to share and cooperate, and to to find best practices for everyone. Oh, I see there's a question.
It says, so at this time, there's no approved 3D printed face mask design. So Sarah, you're talking about the ones that are like the N95 pieces and that kind of stuff? Yeah, they're for Bonnie or for Jim, you haven't seen anything yet for like the ventilator pieces or the full mask pieces, correct?
If you're talking about the actual, as a substitute for an N95 mask, we have not seen anything that's been approved for that purpose.
Okay. And then there was a quick question about, as far as color, is there any sort of color preference for people or anything along those lines for the headpieces?
We don't have a preference as to color. I personally have a preference for purple since I'm a Northwestern person, but you get extra points for purple.
Oh, Christina's sending you all the glow in the dark ones now. You better watch out.
Oh, perfect. Glowing in dark purple would be even better.
Ashley mentioned that Jay Margolis of Space Lab also has a Slack channel for their projects. She volunteered to send the link to us all. So that would be amazing to toss in the spreadsheet as well. I don't see a problem with that. And then Juan actually asks a good question. You know, can anybody speak to the liability of making and creating these parts in the long term?
Well, yeah, this is Jim again, and actually, I'm an attorney by training, and way back when I mentioned this to the folks over at the Hinsdale Public Library. I worked at a firm which I think many of you are probably still using, and Roger Ritzman has been the attorney for a number of library districts, and I worked with him, and so from a liability standpoint. You can always check with Roger regarding any concerns, and I'd be happy to talk to him about that. But one of the things that the governor, provided, recently is a executive order regarding liability and trying to limit that for folks who are volunteering, for hospitals and I'd have to double check and take a look at it, but based on what is in that executive order, I would think that that any liability would be protected by that, once again, obviously you guys have, respective, folks representing you. You can always check with them. But that's an area where, I would feel comfortable that any liability would be, protected under the, what the governor has already offered.
Thank you, Jim. Okay, well, for those of you who have volunteered to share links with us, Dan has shared his email address in that chat box a few times. So please hit him up.
One more time for good measure, right?
Yeah, exactly. That's one of the things library workers and library staff tend to do well, is we tend to have an abundance of input and an abundance of information. We like to share it. So now is definitely the time. And I just, as somebody who's a Rails participant on the user end, just thank you for volunteering to be a space to host all of these things and save our email inboxes a little bit.
Well, thank you, Jen, and thank you for your leadership here today and on the email list. One more big thank you to Jim and Ridgeway and Karen for making this happen, as well as you, Jen, and everyone else who joined. This will be recorded. This is being recorded. This will be available from the Rails YouTube page. We will put that information into the Makerspace email list and try to share it out otherwise. And look forward to this amazing spreadsheet. Yes, thank you all. Thank you all for coming, and again, thank you for being so willing to participate and use all your knowledge. I hope everyone has a wonderful Wednesday.
Thank you.